So a new question, should physicians add non-invasive to the do not attempt resuscitation or do not intubate discussion? Or, in other words, offer it as another option at end of life? And so here we see new data about the perceptions of respiratory therapists versus the physician. So 62% of physicians indicated that non-invasive ventilation should be included in these discussions at end of life. 87% of respiratory therapists feel this should be included. Why do you think we have such a huge number of respiratory therapists wanting this intervention discussed? Probably because we've been there at the bedside when we have that vague notion of, well, non-invasive could be helpful. Well, nobody asked the family, nobody asked the patient before he lost decisional capacity. So the respiratory therapist has that experience of being in that very difficult situation of, I don't know what the patient would want at this time. If we had this discussion with the patient when we discussed end-of-life options, it would take a lot of the question mark out of whether or not we should be able to use this at that point in time.